Welcome to Deeper Than a Disorder, where we take you into the lives of real people living with real disorders, because every diagnosis has a face and a story. We're your hosts, Dr. Ashley Wiley-Johnson
and Dr. George Castle.
Yeah.
It was the one thing that, could keep my mind off of thinking about autism was that I just love cars.
What about the babies?
If it's meant to happen, then it will be.
I thought that football was going to be a way out.
You can't be completely consumed in it. Let's embark on this enlightening journey together as we go
Deeper than a disorder.
Deeper than a disorder. And remember to follow us, like us, subscribe to our channel, and listen to us wherever you get your podcast. Welcome, Victoria.
Thanks for having me.
So tell us about your own journey in mental health and wellness, and how'd you get here?
Wow. Like a lot of Black women, women of color, it's been a circuitous journey. I don't know one woman that has their doctorate that's a woman of color that's been straight through, often because we're caretaking on both ends, the younger and the generation that's our elders. Yeah. So my story had a lot of breaks. I began at Howard, and I then proceeded to get my master's at Texas A&M. Okay. I received my doctorate at Pepperdine, and then I did my doctoral internship at Stanford.
Okay.
And now I'm at the New Vision Medical Group in Beverly Hills. That's a Black-owned boutique mental health practice. And I work with medical doctors, I work with nurse practitioners, and the third clinical psychologist.
Okay.
And plug for clinical psychologists, there's not enough of us, we're only 4%.
Wow.
And I define myself as a wounded healer. I was sophomore year at Howard. I was then a zoology major. Mm. And my mom was just diagnosed with breast cancer. Mm-hmm. And I was taking a lot of antacids and not wanting to identify with anxiety or depression, or not even really knowing how to identify those things. Mm-hmm. And a lot of people of African descent, all over the diaspora, a lot of people of Asian descent, we somaticize mental health issues. Mm-hmm. So I was like, I've been having these GI issues. And then I told her my mom is in the hospital with breast cancer. Mm-hmm. And she listened. And luckily, my botany professor she walked me straight to the psychological services at Howard.
Wow. And
I couldn't get over that process. And in just 8 sessions, it changed my life. So I finished my classes in zoology. And then after I did that, I changed to psychology after my 3rd year.
Wow. So it's a testament to, sometimes I'm a university professor. Mm-hmm. And, oftentimes we're told that, we have to make sure that if there's a student that, aside from what we're teaching, if there's a student that seems like they need more help.
Right.
And, it's something that is affecting their life, affecting their education, to connect them with the proper resources.
Right.
And so it seems like this is a success story in this case.
Amazing story. I'm the first person in my entire family on my mother's side to ever go to psychotherapy. So it was a tool that our family did not have.
Yeah.
I grew up in the church. My mom's a minister of music. We certainly have that on the adaptive side. It's not just my family. We also, unfortunately, have some deleterious maladaptive behaviors with addiction and alcoholism.
Okay.
And so that would be more maladaptive and coping.
Right.
But we did not have, of course, we had the sister circles, all that kind of thing, but we did not have any interaction with psychotherapy or psychological services. So it was really wonderful to add those new tools to my family. Yeah. And now, so many of my family have gone, and we have other mental health professionals, and it's been fantastic.
That's excellent, especially to hear in the African American community. Sometimes, we are afraid to seek help and, afraid to get the expert advice of, people who study this and, work with people all the time and, have really good advice. So I'm glad that your family was, one that embraced, mental health services, and it
Absolutely.
worked out really well.
Absolutely.
Yeah.
Yeah. Well, and you speak to something so true, which is like the evolution of therapy, especially, I feel like in other communities, you might see them engage in therapy, and maybe it's like looking at second generation, but in many Black families, like you said, we might be the first. In many families of color, like they've otherwise been marginalized, we might be the first to try some of these things. And so my question to you is now, as you have seen, like you said, this long path, where have you seen mental health and wellness change since you were like in college, for example?
Wow. So, starting off at Howard, there was an integration of culture with psychology. So, my very first class at Howard was taught by Dr. A. Wade Boykin, and he presided over the psychology of the Black experience, right? And that was that intentional embedding of how culture is apparent. You cannot take culture from the. He let us know that running away as someone that was enslaved was considered a disorder, that there is a cultural embodiment embedded in psychology. It is associated with Western values. And now that's something that's more readily talked about. I also love that in some of the larger churches, for instance, like Faithful Central, there's an integration of clergy and trained mental health laity that have also they have that integration with the spirituality ostensibly. Like I'm licensed to preach in the AME church and the clinical psychology. So it's not either or. You can be saved and you can still get mental health. In the same way you can go to a personal trainer, you can go get psychotherapy and still go to church. We're working together.
Yeah, that stigma of therapy in the Black church is something that we know oh so well, especially if you were raised in the Black church. And it's interesting to see now how like we're like breaking down those walls and those barriers. And I think different people like Courtney Vance wrote a great book about going to therapy and how it changed his life, even as like a Christian man. And
Absolutely.
and that's excellent.
Yeah, I think oftentimes people of faith sometimes do not go get the help, the professional help that they need, because they say, well, I'm just going to take this to the Lord in prayer. Well, you could take this to the Lord in prayer and get some help from a professional.
And what if the Lord sent you a therapist?
And what if the Lord sent you a therapist?
It's the same way the Lord sent you a minister. What if the Lord, like the Lord sent you broccoli and water and some barbells?
The Lord sends people to help you out in your life, right? And so, you don't have to do either or. And so it's a great example. So what has been your experience with dissociative identity disorder, DID?
So it's really, really hard to treat. So you're working with individuals who have had early abuse. We know as mental health professionals, if it occurred from 0 to 6 years old, it's going to be something really deep and systemic. And it's going to be harder to treat. And we also have to be really careful because it can be really dysregulating to the individual just to rip it out. We have a saying in our field that the fastest way to deal with trauma is slowly. So if I have someone that are just associating, I'm going to want to know why. And I'm going to want to know what happened. And I know for sure that either mental, emotional, physical, or sexual abuse and or all three occurred as a child and probably prolonged. So there was a splitting of personalities that was done to help protect the soma and the soul, to help protect them. And I am going to be very careful with what caused that. And I'm going to remain very curious. And I'm going to try to establish a safe and non-judgmental environment that I can. And do what I can to help mitigate what's been probably really, really hard for them if they're changing. Because I've seen situations where in one personality, you may need glasses, you may have a different tone of voice. In another personality, you don't need those glasses, or your voice will be pitched, or you may be scared of maybe dogs in one and then not the other. So, not being judging and accepting what they perceive as their truth, because their truth has been impacted.
Yeah.
If they've disassociated, it's for really deep and systemic reasons, and I want to be careful, very careful.
Yeah.
Well, it's interesting what you're saying too about that, like physical changes when there's a change in personality or the alter. We talked about that with the filmmaker Dallin, and he was talking about the subject in the film was very unique because of his alters. Most of them did have like subtle physical differences, like a tattoo or like something very small, and so everyone, excuse me, so yeah, like a little beat. Yeah, so we talked about something very small changing, like that subject just changed, a tattoo, or would change ages, for example, like that's not exactly physical. Why do people disassociate?
Every single time is to protect themselves.
So
they're
after
feeling
experiencing
something,
the
or-
trauma, experiencing the trauma, the dissociation is a protection mechanism against experiencing that trauma again, or
Defense mechanisms have a bad rap, but they're always to protect, right? We're all dressed fancy, right? But at the heart, we're animals. And if you can think of it as like a prey response, one of the things that can happen, let's say to an antelope or a deer that's customarily a prey, is that they may play dead, right? That freeze response. And so with, let's say, as something that we think of commonly, rape survivors during the actual transgression may disassociate, and because it would be too much for them. And so it's protective. And also you can think of the parallel of going into a medically induced trauma. My brother was in a very, very serious car accident and his head went through the windshield when he was actively serving as a Marine. And they put him in a medically induced coma to protect. And so the body naturally does the same thing. So just as an example, I was, trigger alert, I was sexually transgressed when I was 15. And I had a disassociation around that event, but that does not mean that I qualify for our dissociative identity disorder. But disassociation always is to protect.
Okay.
Yes.
Okay. Thank you for sharing that.
Yeah, and so they are protecting themselves, and then you turn into you have you use your different personality emerges in that moment. What has been so while
so the different personality is usually in relation to the prolonged abuse. As an example, maybe you were sexually transgressed by a primary male figure in your household. Maybe your mother enabled and or knew or did nothing to intervene. You may have an alter that is a mom that would. You may have an alter of a child that has a happy life, that's peaceful, that doesn't have to worry about having their primary figure in the household transgressing them at night.
So they almost turning into what you need at that time.
If the girls in the household are being sexually abused and the boys aren't, maybe you might switch genders as an alter because you're becoming what's not being hurt.
Yes.
So it's something that makes you more than what you are, or it's an escape from what's happening.
Wow.
Or all of the above.
What would you say would be the, like, of the experience that you've had with dissociative identity disorder? Can you tell us maybe an interesting or a case, like just to describe the magnitude of this?
So without giving any information, we call it case studies in our field as clinicians. It was a woman had been raped starting at 3 years old by her father, and it went till she left to go to college. And there were 5 different alters that happened as a result to that systemic and traumatic pain.
Wow.
And another indicator that we have as clinicians on how much someone is suffering and how deep and painful is how many personalities do you have? How many alters do you have?
Wow.
So is it is it fair to say that the more alters someone has, the more of these traumatic experiences that they've had?
It's
Or
so what I do as a clinical psychologist is an art and a science, and so you could have someone that has the same trauma, and they may have 5, and someone may have 4. However, if we're seeing more, we just can loosely know that's it's with the pain, right?
Okay.
It's in mirror of the pain, the amount of pain. So when that's 5, that means that it's been a lot for someone to break into that many. It's been a
It's been a
lot.
lot. So, in research terms, there's a positive correlation, strong positive correlation with the
Yes,
number of
yes,
alters. And okay,
yes. So I just teared
yeah,
up because you have empathy over what occurred to that person for that to happen.
absolutely.
And when you think about that, like that empathy, I just even think about like going through a life where you've experienced some trauma and then to ultimately like live. You said this person was a woman, right? So
Is
they've
a
lived
woman,
their
yes.
life, and
Hmm.
how do they do the everyday things like how work, stay, because that's the thing that I'm like just so like, how do you keep your job and you have these alters? Like, how does that
It
work? Like,
depends. Sometimes you do, sometimes you don't,
yeah.
right? So let's say if you're in therapy, one of the goals may be to reduce the amount of personalities, right? So
Okay.
that would be
Mm.
successful. The gold standard with dissociative identity disorder is dialectical behavior therapy. Cognitive behavior therapy is also used. So dialectical
Mhm.
behavior therapy is getting out of the emotion. And when you see these triggers, what do you do? And
Hmm.
so they could be at a job place, and if they've been through dialectical behavior therapy, then they'll have tools, right? That being
Yes.
said, even in the most ideal situations, sometimes you may experience pressures that you didn't even know how to plan for because of
Mm.
anniversary grief.
Mm.
Maybe it's an anniversary grief of the first time a traumatic event happened.
Hmm.
It may not even be like consciously. And so you may just totally decompensate. And it depends on who you're being employed by. Are
Mm.
they sensitive to mental health issues? Are they scared by it themselves? So whether the person or people can keep their job really depends on the environment that they're in,
Yes.
their level of health, and then the level of functioning, right? Because when you're at a job place, it's not a tea party. So are they able to meet the task? And so
Mm.
it can depend on where they are, both healing and then developmentally. So for me, I can share that I was transgressed at 15 because I'm knocking on 55. That was
Mm.
40 years ago. So the further away, let's say that individual that was transgressed by their father from 3 to 18, the further away that they're on their own in their own household where they're more empowered, chances are that there'll be more healing.
Wow. That's
So
amazing.
the further away from the transgression, the greater the likelihood
Possibility of more healing, absolutely.
of healing.
No, here's a question that I had
Possibility,
thinking,
right?
Possibility.
right?
Possibility.
Possibility.
Because in this case, the individual had a diagnosis of dissociative identity disorder. And then the film came out. And shortly thereafter, they took to social media to say that they had worked with a different therapist and that they actually didn't have dissociative identity and that they were fine. And so as a result, it did the speculation on the outside, the the commenters were basically saying like he's making this up or this man made up this film. And then that like took us into this deep hole of understanding like how intense it is for individuals living with this disorder. Um, what is your thought? Like, have you seen in your practice or have you heard of where somebody might say, I no longer have this diagnosis?
Absolutely. Kanye
Mhm.
saying he's no longer bipolar, right? So, I
Hmm.
mean, in fairness, I've never worked with him or
Yeah.
met him, right? But
Yeah.
he's exhibited manic states. So,
Mm.
uh, I would be more interested in what that truth means to them. Is it a stigma? And then also in our field, we're not infallible, right? We do have
Mhm.
biases. I like to start with a more conservative diagnosis before I'm going to go up to something that's in the cluster of a personality disorder. Personality disorders are tend to be thought of as something that will be with you for a lifespan. And but I would probably view it as a stigma. And we don't want to have these things, right? Like all three of us identify as African American, and we can't change our color. We can't change being Black, nor would I want to.
Right.
However, that position around being Black depends on the context, right? So some of us may have shame depending on if your parents have shame around it, or if you were in a school that shamed you, right? How was the school personnel? So I would say it's probably more attributed to the shame that the individual received, never having met them. The shame versus in a diagnosis actually really changing, because I have not seen that.
Well, that's amazing that you say that, because like they talked about, the filmmaker talked about the shame that maybe the person felt, but also like he didn't feel any shame. He felt a sense of protection of the community, because it came out that he had a BPD, which was like a form of like
Borderline personality disorder.
Yes, borderline personality disorder. And so he said he felt protective of the space and the mental health challenges. But I just think if it was someone that maybe was not as tolerant, they wouldn't have that perspective. And it definitely opened our eyes, and hearing what you're saying too about just like how far you are away from it, and then the stigma that it can occur. I mean, it really sheds light, and something that seemed to go crazy really can teach people tolerance if they take some time and think about it.
Absolutely.
So I'm thinking, what would you tell, everyday people? What do they need to know about someone with, or interacting with someone who has DID?
And even if it's in addition to DID, just living with a disorder, because like we're deeper than a disorder, and we have you, this expert, Dr. Moran, here with us. Like, give us some tea. Like, tell us how can we inspire the next one?
Well, you might not know, right? I mean, unless you're with someone long, because you may meet someone's alter and not know, right? And you may not know, right?
And you may not know.
Yeah, benevolently, like, this is my Sunday flow. I don't go to work like this, right?
Wow.
So we flow into different spaces in different ways, right?
Okay.
So I'm not trying to intimate that my Sunday flow is the same way as an alter, but that can be like if you have a way that you can identify or a way that you can relate. So we code switch, right? Each one of us code switch. We may use something like deleterious. And then if you're talking to someone that's not going to flow with that, or they'll be like, what the blank are you talking about? You're like, that was BS when you did that, right? Or not even saying what it is, right? Like if the patient has started swearing, then you may meet them where they're at or not, right? So
we were just talking about swearing and Tourette's, verbal tics.
Yeah.
Having compassion.
Yeah.
And then one of my mantras that I live by is, by the grace of God, there go I. So it's by the grace of God that the transgression that happened in my life was not by a primary figure. Even though it has impacted me to my core, that I was sexually transgressed at 15, that I was raped, it wasn't my dad. It wasn't repeated. And so those kind of things have a deeper fissure. And so by the grace of God, I was raised in a household where that was not my story.
Yeah. And thank you for being vulnerable and sharing that. I think a lot of people are afraid to talk about it. And,
Absolutely.
And for good reason, right?
Well, speaking of shame, right, I can tell when a patient has mitigated their shame is when they can tell their story. Right. So I could not do this. Even back in 2012 when I was 41, still wanting to do this. But I thought someday, I hope I can. So I really appreciate this conversation, because our stories are sacred, and we shift by stories.
Yeah.
So the more that we all reduce our shame, the more that we can get to our authentic self. And then to me, that's where the greatness happens.
Yeah. And a lot of people are carrying shame. And I think by speaking about what happened, you empower people to also have conversations when they're ready, but have conversations, destigmatize speaking about things and getting support and healing. So I think this is wonderful that, you know, a couple years, and you don't look the age that you say that
At
you
all.
are.
You said 50. No, 39.
Yeah, I mean, you know,
Black and crack.
39 and a half, you know. But yeah, certainly, you know, with time comes healing, or, you know, time and effort, and the just the willingness. There's healing, willingness to do the work, willingness to go seek help. And
Might I add one thing with that?
Sure, absolutely.
Time in the right circumstances, the right milieu, right? So if you're
Yes.
someone, one of the things that can happen that you really need to watch out for people, I'll use myself, that have been sexually transgressed, is that I found myself in my first marriage in a relationship where I had domestic violence, right?
Okay.
And there's a positive, as you said, relationship between people that have endured abuse and then end up in intimate partner violence relationships, because what is familiar,
yeah,
unhealed,
yeah,
feels like love. So unhealed trauma that
Yeah.
feels familiar feels like love. So time in and of itself is not enough to heal unless you have some inputs that are going to be shifting that, right? Unless you have someone that's
Yes.
yeah.
Yeah, like
Absolutely.
therapy. Like I
therapy.
feel like this was
Time
our
and the
like
willingness to
go
go
to
get
therapy.
therapy,
Like
speak to
it's
people. Yeah.
okay to go, and like you're right, like with
Absolutely.
the right
Do the work,
setup,
time and effort.
yeah, you can heal. And so I think that we're encouraging everybody to just like wherever you're at, like you said, it's like we all are experiencing life. We're all experiencing, you know, differences and transgressions. Hopefully you've never experienced them. If you have, and like even hearing
But everyone's
your
been
story.
transgressed, right?
Yes,
So
it
my
makes me
beginning
think
of healing
stories.
began when I saw Oprah talked about her being transgressed by a family member. That was the beginning of my healing. To see a Black woman, I know you could say these things
Shout out to Oprah.
in public. That's right. I know you could say these things. And I've been seeing patients since 2011. I have not seen one individual that is not grieving something that they received and didn't want, or grieving something that they wanted and didn't receive, or both. So it may not be sexual transgression, but everybody wants something. Maybe you have mother hunger. Maybe you have daddy hunger.
Yeah.
There's something that you wanted and didn't receive in most of us.
Well, hearing you, I'll just say for myself, speak about your transgression, just like gave me strength to even just think about my own experiences. And like I'm just hearing it. And like you said, like you find power in other people. So I just want to thank you for like being vulnerable. And like George said, you know, going deeper than a disorder with us. And tell us what's next for all the listeners. How can they connect with you, or what's on the forefront?
If I can just go back to one thing that you said, is that please don't feel any pressure to share. Like, oh, Dr. Moran shared, because as I said, it's been 40 years.
Right.
I share when I was ready.
When you're
And
ready. When you're ready.
one of the things that I share with my patients is that heal yourself first, and only when you're in the overflow, then heal others.
Yes. Gems from Dr. Moran. Thank you, Dr. Victoria Moran. We appreciate you for being here with us. And
Yeah.
thank you for
I
going.
can't answer the what next and how to reach me, though, if you
but
want.
Yeah.
Oh, yeah. That's right.
That's the
I don't
question
wanna
that I was
bypass
going to go back to,
that.
right? How do they reach you?
At the very least,
How
your
do they
sober
reach
need your
support?
jacket. Okay. That's
Right? How do they reach support? How do they reach
Yeah.
you or others like you?
So I'm proud to be at the New Visions Medical Group. The principal owner of that group is Dr. Rodney Collins, that's a psychiatrist. And he began his journey at Stanford, and he concluded at Howard Med School in 83. So he's been doing this for 41 years. So at newvisionmedicalgroup.com is a fantastic way. And then I also have a personal website, askdrvictoriamoran.com.
wonderful.
Great.
Well, thank you, Dr. Victoria. We appreciate
you.
you.
Thank